Now, what if there is a stone in the terminal part of the bile duct? So the next question people ask, if there is stone in the bile duct or if the patient has got jaundice, can still be surgery, microsurgery, laparoscopy can be done? There's one more thing which is asked normally, what should we do for not getting gallstones? So now, if we try to answer that how to avoid gallstone formation, one is to live a healthy lifestyle, do exercise at least 30 minutes a day, 5 days a week, have a proper healthy diet with high fiber content, and avoid refined sugar, carbohydrate and unhealthy fat. Don't try to be on a diet where you suddenly lose a lot of fat and trying to drastically lose weight, and avoid birth control pills. These things will take care of probably not giving you at a higher risk of gallstone. Next thing, now that the stone is diagnosed, what should we do and when? One question which I always face is there nothing else that can be done without surgery? Because whoever wants to have a surgery. Now we must remember the first indication of surgery in any disease is failure of medical treatment. Because if there is a medicine available, why on earth would anybody want to do surgery? So we have very clear in this concept that there is nothing else available except surgery. Now surgery is of two types. One is what we used to do in past, which is conventional open surgery. You cut open the tummy and you remove the gallbladder after ligating the cystic duct, and those days are gone now. Now it is laparoscopic surgery where you make a small hole near the navel, put your telescope inside, put a camera attached to it and make 2 or 3 small trocars hole inside and actually put your instruments through it and then dissect the gallbladder out, clip it, cut it and take it out from the liver bed, which is basically called cholecystectomy, removal of the gallbladder along with all the stones. Next question. How long can we wait? I get this all the time. Well, doc, my son has got an exam next month, my daughter's getting married. Now these things, the stone is not aware of it. So whenever I need to answer this question, that how long can I wait or how long is it safe? The honest answer is that there is a possibility nothing may happen in next 1 or 2 years, and there is also a possibility something may happen tonight. So it is always better that if you have been diagnosed with gallstone, there is no point waiting for any of the complications to take place, that the best thing to do is to get it done with. Another thing that is always in the mind of the patient is there any risk? What are the complications that can arise? Now there isn't any procedure which is without any risk or any complications, but with advancement of anesthesia and with newer technologies and advancement of surgical technique, now we might say that the risk of a gallbladder surgery is very, very, very low. It may be 0.01 to sometimes 0.1% cases you may have complications. So what are the complications? There can be bleeding, there can be infection, or there can be injury to the surrounding area of the structures, which could be biliary tree, bile duct or intestinal injuries. Sometimes gallstone can have other complications. It can form gangrenous, it can rupture, it can form a fistula through, it's called cholecystoduodenal fistula. Another thing is the patient want to know how long is the hospital stay and by when they can get back to work. Now for laparoscopic removal of gallbladder, which is known as lap chole, usually the hospital stay is 24 to 48 hours and they can get back to work within 7 days. And in open surgery, the stay in the hospital is 3 to 5 days and they can also get back to work in 10 to 14 days time. Going back to work sometimes depends probably on the type of or the duration of holiday they have available to them. Otherwise, medically or surgically, there is no restrictions for anybody to get back to work within 7 days. Next question is asked, well, doctor, if the gallbladder was there, as everybody says it was given by God as an organ, now an organ is gone, what will happen to me? What happens to people who do not have gallbladder more? Initially, for a few days, some people may develop a little digestive problem, indigestions. Some people might get a post-cholecystectomy diarrhea. They can develop increased number of bowel movements, but they usually tend to settle down with time and they can be taken care of with medications. Next, do I have to go to a special type of diet after gallbladder surgery? The answer is no. We always have this concept that after surgery, everybody goes into a bland diet. You are not allowed to take fatty food, fried food, or masala, or chilies, or anything like this. My recommendations, or our recommendation, is there is no need for any special diet. Whatever you were eating before surgery, you can eat the same food after surgery. Well, I think now we have answered most of the questions. So what is gallbladder, what is bile, how the stones are formed, what are the symptoms, how to diagnose, and what to do if you are diagnosed with stones. And we have answered the questions which people have normally asked me in the chamber. So if you have enjoyed watching this video, please like, share, and subscribe to my YouTube channel, and continue watching our YouTube videos on healthcare, charity, education, production and entertainment, and food and beverage. Our health cafe, Ecclesiastes, the first health cafe with a twist in West Bengal.